It's Friday, October 25th, and this is the Daily Medical News, where we bring you the top headlines in clinical medicine, plus an in-depth look at the day's biggest story. I'm Nick Andrews.
And I'm Mary Ellen Schneider. Today, food addiction may be a key link between psychiatric disease and reduced life expectancy.
Infection experts recommend two options for pertussis vaccination.
Hormone therapy in transgender patients is safe for bone.
And how to overcome barriers to exercise for cancer patients.
Plus, a decade of safety data from Topical tacrolimus offers reassurance on cancer risk in patients with atopic dermatitis. Before we start, we'd like to ask for your help in making this podcast better. Please take a moment to complete our short listener survey by following the link in the show notes. And now, the news.
Food addiction is 3 times more prevalent among people with clinically diagnosed mental disorders than in the general population. It's a finding that supports the hypothesis that food addiction is a key link in the chain connecting psychiatric disorders to increased risk of obesity, which in turn contributes to the substantially shorter life expectancy of psychiatric patients. That's according to researchers at Aalborg University in Denmark, who reviewed data from the Food Addiction Denmark project. They presented their findings at the annual Congress of the European College of Neuropsychopharmacology. The investigators found that food addiction prevalence was nearly 27% in people with mental disorders compared with 9% in the general population. The rate was 30% in people with a DSM-5 personality disorder, 28% in those with a mood disorder, and 17% with autism and other pervasive developmental disorders. The prevalence of food addiction was less than 12% with a psychoactive substance use disorder and 16% among patients with ADHD and other behavioral disorders.
Either the Tdap or TD vaccine is an acceptable option for pertussis vaccination in most situations. That's the recommendation from the CDC's Advisory Committee on Immunization Practices. In a unanimous 14-0 vote at the October meeting, ACIP members agreed that current data support the use of either the Tdap or TD pertussis vaccine in 3 areas. Those 3 options are as a decennial booster for tetanus prophylaxis and in the setting of wound management, and for additional catch-up doses based on the immunization schedule for people aged 7 years and older. The panel said safety data showed no differences in safety concerns between Tdap and TD, including data from pregnant women. Several ACIP members noted that the revised language to include both Tdap and TD reflects the increased use of Tdap, and it maximizes flexibility in clinical settings.
And there are no short or long-term risks to bone health over the life of a trans person who receives hormone therapy. That's the summary from Dr. Martin den Heijer of the VU University Medical Center in Amsterdam. Dr. Heijer reviewed the latest research at the annual meeting of the American Society for Bone and Mineral Research. A 2013 and a 2019 study both showed that at baseline, trans women have lower bone mass than do male reference populations, with lower BMD at the hip, femoral neck, and spine. After 1 year of treatment, however, there were significant increases in BMD in trans women in the lumbar spine, femoral neck, and total hip. Trans men also had increased BMD in the lumbar spine and total hip. The authors of a 2019 study did find that trans women had a higher incidence of osteoporotic fracture of the hip, spine, forearm, and humerus compared with cisgender men and cisgender women. Given the findings, Dr. den Heijer says attention to lifestyle factors remains important, particularly smoking cessation, vitamin D intake, and regular exercise. We'll be right back after this message.
There's increasing evidence that exercise lowers the risk of developing cancer, improves survival after a cancer diagnosis, and helps ease related health outcomes. But relatively few cancer patients meet current physical activity guidelines, often because their doctors failed to recommend it. Why? Many clinicians aren't aware of exercise's potential value in cancer patients, and there's uncertainty about the safety or suitability of exercise in some patients. To reverse that, members of the American College of Sports Medicine International Multidisciplinary Roundtable are asking doctors to take an assess, revise, and refer approach to recommending exercise. The panel members recommend asking patients how many days during the past week they engaged in a physical activity for more than 30 minutes, or how often they had undertaken activity to increase muscle strength. If the patient can exercise safely without medical supervision, clinicians should advise patients to increase their physical activity to achieve recommended levels. Clinicians can also refer patients to community programs to help ramp up their activity. For patients who can't exercise safely on their own, doctors should make a referral to an outpatient rehabilitation professional. The recommendations appear in CA, a cancer journal for clinicians.
No hint of increased cancer risk emerged with up to 10 years of topical tacrolimus use to treat atopic dermatitis in children in the large prospective APPLE study. That finding, paired with similar data on pembrolizumab, has some wondering if it's time to move past cancer fears when using topically applied calcineurin inhibitors. Those agents' box warnings have been the source of enormous frustration for dermatologists and other clinicians. The warnings were ordered because of regulatory concern about an increased risk of malignancy in organ transplant recipients on systemic calcineurin inhibitors for immunosuppression. That's despite the fact that, unlike systemic versions, the topical agents are used intermittently. Their systemic absorption is low to nil, and no plausible mechanism by which they could cause cancer has been outlined. Researchers at Christian Albrechts University in Kiel, Germany, presented the APPLE study data at the annual Congress of the European Academy of Dermatology and Venereology. APPLEs included nearly 8,000 children with moderate or severe AD. With nearly 45,000 person-years of follow-up in APPLEs, there were no lymphomas and just a single case of skin cancer. Those two types of malignancies were singled out as being a particular concern in the boxed warnings for topical tacrolimus and pembrolizumab. A total of 6 cancers were diagnosed in 6 patients during the nearly 45,000 person-years of prospective follow-up. None of those malignancies is classically associated with immunosuppressive therapy. And that's it for today's Daily Medical News. Be sure to listen to the newest episodes of the CardioCast and the Post-Call podcast. CardioCast and Post-Call have new episodes dropping every Friday. For MDedge, I'm Nick Andrews.
Our stories this week were contributed by Therese Borden, Andrew Bowser, Steve Semino, Jeff Craven, Richard Franke, Sarah Freeman, Bruce Jancin, Jim Kling, Mark Lesney, Bianca Nogrady, Will Pass, Heidi Spleet, Michelle Sullivan, and Gregory Schwachtman. Our editors include Terry Rudd, Kathy Scarbeck, Denise Fulton, Therese Borden, Katie Lennon, Glenn Williams, Richard Peasy, Laura Nicolaides, Catherine Nellist, Jeff Evans, Elizabeth Meshkati, Laura McGlade, Mark Lesney, Gina Henderson, and Catherine Hackett. And I'm Mary Ellen Schneider. If you like what you hear on the Daily Medical News, please leave us a review or rating on Apple Podcasts. And check out the full stories available via the links in the podcast notes. Have a great weekend, and we'll see you next week.